I have my 36-week appointment today. I'm not allowed to have anyone with me. But are you wanting to meet me afterwards to see the ultrasounds and I can tell you what the doctor says? Come over to the house. No, I'd prefer to meet somewhere in public. Where would work for you? If you won't come home, I don't want to see your fucking face. Leave me alone. Okay. Hey there, Molly. How are you feeling? I'm okay. Super sore. Ready to be done being pregnant. It'll happen faster than you think. But remember, you want to let this little nugget cook as long as possible. The last few weeks are the longest, but still very important. I know. I can't wait. All right, well, let's go ahead and lay you back so we can get one last look at this baby before their birthday. Hey, is everything okay? You've not said anything this whole time, and I'm starting to feel really worried. Is something wrong with the baby? Okay, Molly, we need to have a quick chat. First, I want to tell you that your baby is fine right now. They seem perfectly healthy at the moment. Okay. So, what's the bad news? I know that there's a but coming in this. As of this moment, it seems as though you have a partial placental abruption. It has not completely detached as of yet, but it could happen at any moment, which will lead to your baby not having any oxygen or nutrients to continue to grow. You are going to need to deliver today. Unfortunately, that is not all. In your ultrasound, it also looks as if the umbilical cord is double wrapped around the baby's neck. We're going to be taking you into labor and delivery right now for an emergency C-section. It's baby time, Molly. Molly, are you okay? Is the baby okay? What's going on? How did you know that I was about to go into surgery? I didn't call you. I'm still listed as your emergency contact at your opt-in. The receptionist called me to tell me to get to the hospital. What is happening? I have placental abruption and the cord is double wrapped around the baby's neck. They have to give me an emergency C-section. That's all they really said. You're only 36 weeks. It's too soon for the baby to come though, isn't it? The doctor said they look like they are a good size, and she can tell they have been practicing their breathing. So she is confident the baby should be perfectly fine and only need minimal NICU time, if any at all, once born. And if the placenta detaches completely, the baby will basically suffocate. So there isn't an option. They have to come right now. You don't have to be here though. I want to be here. I want to be here for you and the baby. I love you, Molly. I know I've done such a shitty job showing it these past few weeks. I know I can never make it up to you. But please let me try. Just let me stay and be here with you. You can stay if you want. That doesn't mean we are getting back together, though. That doesn't matter to me right now. There is no one else that matters to me right now in this entire world besides you and our baby. I will do anything for you all. I understand now. I am so sorry for everything. Just shut up, please, and hold my hand. I'm scared. anything you need. Just tell me what you want, and I'll do it. I'm here for you. I want you to shut up. And just hold my hand. They're about to come in and will me back. We're about to have our baby. You did so good, baby. Our baby is here, and she is absolutely perfect. How are you feeling? I feel numb right now. I still can't really move my body. What happened? The doctor said I was going to be awake during the procedure, but I don't remember it. You don't remember. You started screaming mid-incision? The doctor had the anesthesiologist knock you out immediately after that. It was scary, but you pulled through like a champ. Is the baby okay? Where is she? She cried so loud once they pulled her out and cleaned her off. She's beautiful. I can't wait for you to see her. The nurses have her in the NICU right now doing her newborn tests and letting you get some rest. Hi there, Mama. How are we feeling? Ready to get up and walk yet? Not quite. My legs are still pretty numb. How is my baby? Well, that's what I am here to talk about. She is okay now and is being monitored in the NICU. But we do need to discuss the possible outcomes of your placental abruption and what that can mean for your baby's quality of life. Did something happen to her? She had a minor seizure during her after testing. This could be a one-off thing, but it also could point to other conditions that can be caused by placental abruption. You said it was only a partial abruption, though. I thought she was going to be fine because we caught it in time. Unfortunately, ultrasound is not always completely accurate. The abruption was worse than we originally thought it to be. We are lucky that baby pulled through as well as she did. She is alive and breathing and appears to be very responsive. There is not reason to assume the worst as of yet. Well, what are we supposed to do now? How can we help her? The best you both can do at the moment is prepare your... Hey Mama, have you been to see your baby yet? Yes, she's absolutely beautiful. The nurses said you were going to come talk to us about possible diagnoses and treatment options. What's going on? Yes, we definitely have some things to discuss. With the seizure, your daughter's low APGAR score, and overall low muscle tone in her body, we have reason to suspect that she may be suffering from hypoxic ischemic encephalopathy. What is that? It is a type of brain damage newborns can suffer from oxygen deprivation and limited blood flow. I know this sounds very scary, but at this moment we do not know how severe of a case she may have. Many babies with mild cases go on to live perfectly normal lives. Is this my fault? Should I have did something different or ate different or tried to push for a sooner APPT? No, of course not. You did nothing wrong. All we need to focus on now is providing treatment to minimize damage. There is a treatment we have heard good reviews about, therapeutic hypothermia, that we can try if you give us the go-ahead. Yes, of course, anything that will help her. Please just help her. Okay, I will let the medicinal team know. Just hang in there, Mama. It will be okay. We will all do our best to help her. You realize she's just be positive to try and avoid a lawsuit, right? You both could have prevented this. Manny, don't say that. Please, can we just focus on our daughter? I am focusing on how you and that crackpot doctor have completely ruined her life. You have made sure she will never have a normal life. What kind of mother are you? How did you not know your daughter was in distress inside of you? Manny, there was no way for anyone to know without an ultrasound. You should have known. You did this. You need to leave. Now. I don't want you near me. It was a mistake to let you stay this entire time. Like he 11, I'm leaving. I'm not leaving my daughter in the care of people who haven't cared about her this entire time. You can't make me leave. I have rights. You have no rights. You are here as my support person, and I do not want you here anymore. So I suggest you leave before security escorts you out. I am my daughter's support person. I will stay here as long as I want. You can sit here and bitch as much as you want, but I know I have my rights. Your rights? I'm sorry, what gives you those rights? We aren't married. That baby is solely listed as my baby. So take me to court for your stupid ass rights, because as of this moment you have nothing. Go take care of your fucked up mommy and get the He 11 out of here. I promise you, you're going to regret all of this. Nobody hurts my baby and gets away with it. You'll regret this the rest of your life. I hate to intrude, but I was just next door with a patient and overheard your conversation. Are you okay? Yes, I am. I'm just kicking myself for letting myself even think that asshole could have changed for the better. I'm sorry if we disturbed your patient. Don't apologize. I just wanted you to know. I am on your daughter's care team. She is such a strong little girl, you can already tell. You are doing the right thing by her, and she is going to prove to everyone what a fighter she is. Thank you. Do you think she's going to be okay? I can't make any promises, but I wouldn't count her out anytime soon. If you're feeling up to it, I can help you up and we can go visit her. Yes, please. I really would like to just see her right now. I know I can't hold her during her therapy, but just seeing her would make me feel better. Of course. And once we are done there, and you are back in your room, I am going to have someone from Family Services stop by to help you navigate. Hi, Molly. I am Janine from Patient Advocacy. I was told you were having some issues yesterday with your partner. Is there anything you need to talk about? No, am I in trouble or something? I apologized if we had caused a scene. No, of course not. We just want to make sure that you and baby have a safe place to go home to once you are released. Oh yes, we are safe. We do not live with him anymore. I thought maybe he might have changed when our daughter was born, but I can see now that that won't be the case. Baby and I will be staying with my friend. Is there an issue with domestic violence or Dr. G. Abudalari in your past relationship with the father of your child? No, of course not. Manny never put his hands on me. He was an active addict in his teens, but has been sober since. But he has gone absolutely off the rails since his mother relapsed and he took her in. That was the cause of our relationship to end. And how do you know that he is still sober? It is much more likely for someone to relapse if a person they are close to also has relapsed. I guess I don't really know for sure anymore. When we still lived together, I never saw him using or under the influence. It may be naive, but I am just still in the denial phase of it being a possibility at this point. I understand and sympathize that this is an extremely difficult and sensitive time in your life. But speaking off of the record, as a mother myself, I would do everything in my power to keep your child away from her father until you know he is sober or until court ordered. Otherwise, I don't really know what to do. I know that until we go to court he has no rights, even though he is listed on the birth certificate. But beyond that, I am just lost. Should I be talking to lawyers already? Ma'am, if he is indeed listed on the birth certificate already, I would make an attorney's office my very first stop upon being released. I wish you and your baby all the best. If you need a list of resources to help you navigate how to obtain a lawyer, please reach out at any time. Good news, Mama. I know you all have been here for a few days now, but your sweet girl has been responding fantastically to treatments and the anti-seizure medication she was prescribed, and she should be ready to go home tomorrow. Are you sure? She still seems so little. I don't want to take her too soon and something bad happen. Yes, Molly, I am sure. We wouldn't let her go if we weren't sure. I understand how scary it must seem to you, but she is doing so well considering. And we are just a phone call away if you have any questions. Okay. I can't believe this. I thought we would be stuck in here forever. I'm so happy. I can imagine. But I will stress this to you. It is incredibly important for her to never miss a dose of her medication and to stay as healthy as possible. With her condition, a common cold could be devastating to her immune system. Okay, of course. What happens if she accidentally dismisses a dose, though? What do I do? If she misses a dose, it could begin to trigger her seizures again. I would ask if she misses a dose to bring her into the emergency room as soon as possible for monitoring. This could change as she gets older, but at her age it can be devastating. Of course, I completely understand. I want to do whatever I can to make sure she can have a healthy and normal life. And she has every chance to lead a normal life. We were able to detect her symptoms extremely early on and intervene before there was catastrophic brain damage. If we continue with the treatment plan we have in place, your little girl will be able to grow up and have an amazing and normal life. I have a few pamphlets for support groups that may interest you. They are extremely helpful. I highly suggest you reach out to them if you need to talk to someone who understands what you're going through. My baby is home. How are you? I'm so sorry I couldn't come see you. They wouldn't let me up into the recovery ward because of my damn allergies. I got tested and everything, but I still was denied. It's okay. It gave me time that I needed to really focus on what I needed to do with daughter's treatment plan and also finding attorneys to talk to about my custody case. I'm happy to be back though. I hope you don't mind, but Brian and I went ahead and set up all of the baby furniture you hadn't had a chance to get to yet, and finished putting your room together. Mom and Dad also went all out and bought the baby enough clothes to last a year. That's amazing. Thank you so much. I'm still in a lot of pain from the C-section, so I doubt I would actually have been able to get it all put together. Did you stop at the attorney's office on the way home like you talked about? What did they say? They let me do a Zoom conference because of COVID, but yes, I paid my retainer for my attorney. She said it could take quite a while to get in front of a judge because the courts are closed and extremely backed up. But she thinks we have an amazing case. Well, that's good. But what did she say about Manny having his stupid-ass useless name on the birth certificate? That's the issue. She says that as long as daughter is in my care, he cannot just come in and remove her. But he would be able to take her from anyone else because until a judge grants it otherwise, he does have parental rights. Okay, well then we will make sure that he is never around when you are not here. We aren't going to let him or his nasty-ass mom around my sweet girl. She deserves so much better. I just want him to get his shit together so he can be a father. He was so excited when we found out I was pregnant. Until his mother got involved, I honestly thought he would be the best dad ever. Don't blame yourself, because he is a fuck-up. You just focus on taking care of yourself and that baby, and we all have your back with the rest. You aren't alone in any of this. I promise. I saw your car parked at Diana's when I drove by earlier. Does that mean you are both out of the hospital? Yes, we are home now. Okay, I want to come see my baby. I will be there soon. Why now? You haven't wanted to see her or hear about her for the past 2 weeks while she was in the NICU. Do you just want to come now because it's more convenient? It was too difficult for me to see her in treatment like that in the NICU. And I definitely didn't want to see you. So I thought it was best to wait. Well, you are welcome to come see her now, but you will also have to see me. Daughter will not be leaving with you. Her medication schedule is too important to risk messing up. I can handle giving her medicine. I'm not an idiot. But I know I have the right to take her with me if I choose to. I am her father, or are you already trying to alienate me? Manny, she will not be going with you. She is 2 weeks old, fresh out of the NICU, and is breastfed. She will be staying with me, but you are welcome to come visit. Fine, I'll play along with your games. I will let my family know, and we will be there in about an hour to meet daughter. You are welcome to visit, but that is all? Our daughter is medically fragile and does not need to be exposed to any unnecessary germs. You would know how dangerous that would be for her if you came to the hospital or at least answered the phone. That's bullshit. My family isn't sick, and they wouldn't come if they were. They can come see my child if I want them to. We are in the middle of a pandemic. They could be asymptomatic carriers and not even know it. Do you not understand how devastating that would be on our daughter's immune system? They can meet her in a few months when she is stronger and her doctor clears it. This is absolute bullshit. I see exactly what game you're playing and I'm not doing it. I'll be there soon. I don't want to hear anything out of your mouth during my time with daughter.